Hi there, my name is Hannah Eisen, and I am a cardiovascular genetic counselor here at the Stanford Center for Inherited Cardiovascular Disease. I'm joined today by a few of my colleagues to speak with you all a little bit more about a new medication that was just approved by the FDA within the last few months for patients with a certain type of cardiomyopathy. We'll start off by having our colleagues introduce themselves to you all, and then move into talking a little bit more about what this medication is, who's eligible, and what the process is in place for sort of starting to roll this out to patients that we care for. So with that, I'll go ahead and turn it over to my colleagues to start their introductions.
My name is Taka Kawana, one of the cardiologists at Stanford. And I specialize in heart failure and cardiomyopathy treatment. And I also do research in hypertrophic cardiomyopathy.
Great.
Heidi Salisbury. I'm a clinical nurse specialist working with patients who have cardiomyopathy with the Center for Inherited Cardiovascular Disease, and I'm the program operations coordinator for the center.
Hi, my name is Kim Hecker, and I'm the nurse with the Stanford's Inherited Disease team and one of the champions for the new medication, Mavacamten.
Great, thank you. And thank you all for being here with me today. We wanted to start off by discussing a little bit more about what exactly this medication is and what population of patients this medication is applicable for. So we're going to first start off by turning this over to Dr. Kawana to talk a little bit more about that.
Sure. So Mavacamten, or Camzyos, which is the brand name, is a class of medication called a myosin inhibitor. Myosin is a protein in the heart muscle, and when you have a genetic mutation in myosin and other proteins in the heart muscle, it leads to hypertrophic cardiomyopathy. So the years of research has shown that if you, the effect of the mutations in these proteins lead to increase in the function of the heart muscle. So the idea is to try to develop a specific medication that inhibits the muscle protein function. So that's what this Mavacamten is. And the multiple clinical trials have been done for this medication, and eventually we've completed a phase 3 trial. That's the last trial, looking at the effect of the Mavacamten in a hypertrophic cardiomyopathy patient with obstruction, meaning that there is some bulging inside the heart cavity that obstruct the blood flow out of the heart. And this is a special type of hypertrophic cardiomyopathy. And this really Mavacamten really showed a very good effect on the symptoms and how much the patient were able to do on a treadmill. There's a lot of change, improvement in the echo findings, and overall, our patient had a very good response in terms of the symptoms. So, so these results led to the approval of this medication by the FDA in the late April, and we're just about to use these medications in many of our patients.
Great, thank you. And just to make sure it's clear too, so what patients would be eligible for this medication, or exactly what patients is this medication targeted at? So
this medication currently is approved for patients with obstructive HCM, hypertrophic cardiomyopathy. So meaning that, again, this is a special type of HCM patient with pressure gradient inside in the heart. So there's the blood flow is blocked because of the thick heart muscle. So when you look at the echo report, you may see something like LVOT gradient. That's the pressure gradient within the heart. And when you have these significant gradient and the symptoms, if you're feeling short of breath, having chest discomfort, things like that, then you're eligible for this medication.
All right, thank you, Dr. Kawana, for going over that. We're going to go ahead and shift to talking with Heidi a little bit about how we are determining what patients are eligible for starting this medication and sort of the process for rolling this out in our clinic.
Great. Thanks, Hannah. So now that you have a little information about Mavacamten and how it works from Dr. Kawana, you might be thinking, is Mavacamten for me? The first thing to do really is reach out to your team and ask, and we're happy to help guide that answer. But in general, Mavacamten was approved by the FDA to dispense to humans on April 28th, 2022. And not only is Mavacamten a new drug for our heart patients, but it's a new drug in its class for humans in general. And so because of that, there's a little extra rigor and regulation applied to who can take Mavacamten really at first, this as we're just getting it up and running. So it's really important just to kind of set expectations that while we're very excited about Mavacamten and the promise for Mavacamten for many of our hypertrophic cardiomyopathy patients, right now we can only use it for a very specific part of our patient population. And that patient population includes individuals who have obstructed hypertrophic cardiomyopathy, like Dr. Kawana explained, that higher pressure building up in your left ventricle, and that the kind of magic numbers there are you have to have a resting left ventricular outflow tract gradient of greater than 30. So that pressure in that left ventricle needs to be greater than 30 at rest in order for you to be considered for Mavacamten. And you also have to have symptoms that meet the criteria for class 2-3 heart failure. What does that mean? It means that you're living with symptoms such as shortness of breath when you move, chest pain or chest pressure when you move. And this kind of criteria of class 2-3 heart failure. How do you get this criteria? How do you know if you fit in that category? You talk with your team, you talk with Dr. Kawana, you talk with your nurse, Kim Hecker, and they'll help you answer that. And so just to summarize, right now, Mavacamten, individuals who are candidates for Mavacamten have a resting gradient, left ventricular resting outflow tract gradient of greater than 30 or greater, and meet symptoms that meet the criteria for class 2-3 heart failure. And you have a ejection fraction greater than 55. Those are the bullet point inclusion criteria. Kind of the nuanced inclusion criteria, if you're going to take Mavacamten, it requires a lot of appointments, a lot of scheduling. And so you really need to talk with your team about if you're in a place in your life where you are able to have frequent visits, frequent appointments. And then there's also some insurance challenges that are a reality right now as we're really getting this medication out to our patients for the first time. And you're going to hear a little bit more about those as we move forward.
Some of the other questions that we know might be coming to mind include things like, how is this medication given? And what is the protocol in place once somebody starts taking this medication? And so Kim is going to go ahead and talk with us a little bit about that process.
Great, thanks, Hannah. So once you and your provider and team have decided to start on Mavacamten, the medication is initiated, the dose is initiated at 5 milligrams, which is 1 capsule by mouth daily. And as Heidi mentioned, there's a pretty specific protocol to follow up and to make sure you are symptom-free and not experiencing side effects due to the medication. And what that looks like is a combination of testing and a visit with your advanced practice practitioner. And the testing would be an echocardiogram. The echocardiograms are set up in a very specific schedule. The first one at 4 weeks post the medication start date that was determined by your team. The second one at 8 weeks post that start date, followed by 12 weeks. And then the next one is at 24 weeks post the start date of the medication. At the 1-year mark of taking the medication, a CPX or cardiopulmonary exercise stress echo will be required to review that left ventricular outflow tract gradient and to continue to monitor your ejection fraction. If at any point during this time, if the patient is experiencing any symptoms of heart failure or if a dose change is needed, then another echo will be required. So taking this medication really does require really close contact with your team's nurse, as well as the advanced practice practitioners. And then followed by the echocardiogram, there will be either a phone or video visit that happens with the nurse practitioner or CNS on the team to really review those echocardiogram results in detail, to really assess the patient themselves in terms of how they're feeling and if they're experiencing, again, any side effects or any symptoms. And then based off of that visit and those echocardiogram results, then we can determine any dose changes that might be needed to be made to the medication. Once all that is complete, we then submit a form to update the status of your echo results and to allow the pharmacy to dispense the next dose of medication.
Thank you, Kim, for going through that with us. It sounds like there's a lot of touch points and check-ins with the team along the way. So it's a process where the patient's working very closely with our team throughout. Does that sound right?
Yeah. Yes, definitely.
Great. And then I'm sure that another question that comes up too is regarding sort of the insurance process. You know, how does that work? Who is getting covered? Can you talk to us a little bit more about that process?
Yeah, of course. That's definitely been a little bit of a tricky process and something we've learned more as we get more patients on Mavacamten. I mean, initially, once the patient has been considered eligible by the provider, we have to enroll the patient in what is called the REMS program, and essentially is just a program that the FDA is requiring because this is a new class of medication that helps us keep a really close eye on the patients and making sure we are doing these step-by-step check-in processes. So once we get them enrolled into this program, we then have to enroll the patient into another authorization process, which allows us to submit information to their insurance to review for approval. So it's a combination of 3 different steps of enrollment. And then at that point, we actually just have to sit and wait for the insurance approval to come through, or decision, I should say. And that decision, of course, can go 3 different ways. Approved, denied, or in some instances approved, but maybe the patient is seeing a fairly high or decent out-of-pocket costs. In the case of the medication being approved, great, we can get them started on the medication pretty quickly. In the case of insurance approval, but with high out-of-pocket costs, the Camzyos brand has a financial support assistance program available to help determine helpful options for the patients. And then in the event that the insurance does decline the medication, we as the provider do have options to appeal that decision.
Okay. Sounds like it's a pretty lengthy process as well, but I'm curious, have we had success?
We have, yes.
Okay, so that's really exciting. Great. Okay, and then I think just to wrap up some of our last few questions, turning it back over to Heidi, questions just about the medication. Is this something that is a lifelong medication, and are there any known side effects that we're aware of?
Yeah, thank you. Thank you, Heidi. Yes, at this point, this is a lifelong medication. It's a medication that that a patient will take as an alternative to seeking potential open heart surgery, for example. It's a medication that, when working well for a patient, reduces their symptoms, improves their quality of life, both by patient-reported survey and also by exercise objective evidence such as exercise testing. And so the goal is that a patient would stay on this medication for a lifetime. Side effects. Side effects are a really important part of the conversation. It's really important that we partner with our patients so that we can, patients feel empowered to monitor for side effects at home, and also that our team is in place should they need any support while they're adjusting to the new medication. As part of the process of starting Mavacamten, you receive education from your physician or your nurse practitioner that's prescribing the medication, as well as from the nursing team. And you'll be given patient brochure to read and review, as well as helpful websites that provide information about what to monitor for at home. And then I'll give you just an overview now about the general side effects. The black box warning, the scary black box warning for Mavacamten is heart failure. And that is reduced function on the left side of your heart, where the pump of your heart is not moving forward and you have symptoms of congestion, swelling in your legs, abdomen, and face, difficulty breathing, especially when you move and or lay back at night, chest pain, skipped heartbeats, palpitations. So symptoms that might be consistent of retaining fluid and or difficulty breathing, especially when you're at rest or moving, could be symptoms of heart failure. And so, and weight gain as well. And so you talk with your team about these symptoms right away. That's the black box warning. That's the serious potential side effect for Mavacamten. I want to just hit pause for a moment and say that in our trials, in individuals who did experience a shift towards heart failure, and we needed to stop or pause the medication, these individuals either, if they did have to stay off the medication, their heart function returned to baseline. If they, and in many cases, we just reduced the dose of the medication and their heart returned to baseline. They were able to proceed, but on a lower dose of medication. So although this is the black box warning, heart failure, that's a scary term, what we're doing is we're working with our patients to monitor for symptoms that might give us a hint that heart failure could be coming. And our goal is that we would avoid ever getting into full-blown heart failure. I'm going to ask if Dr. Kawana or Kim want to chime in there because it's such an important piece.
No, I think Heidi, you summarized it very well. So this is medication, new medication that we're learning how to use it in individual patients. So it really needs a close monitoring, and we just need to have a sweet spot for each patient about how many milligrams is good enough for you for the patient to get improve the symptoms, but not too much inhibition of the muscle. So I think that's why it's very important for us to work with all the patients when they're on this medication, and until we reach the stable dose, stable echo, it's going to be a work in progress.
Thank you. Yeah. Less serious side effects, but still fairly common and important to mention from what we learned in the clinical trials are actually lightheadedness and dizziness, and occurred in anywhere from 15 to 25% of patients. So important to know that that is something that that an individual might experience. Does not mean that we would stop or have to interrupt the medication necessarily. Many patients adjust, but it is a side effect that can happen. And then finally, this medication, Mavacamten, interacts with a lot of medications in a negative way, and in interacting with these with other medications could increase your risk for that black box warning of heart failure symptoms or heart failure. And so, as part of learning about Mavacamten and taking Mavacamten, it's important that all of your other medications are reviewed by your team. And in many cases, they'll even do a consult with pharmacy to see if there's any drug-drug interactions. Just to review some of the common drugs that do interact in a negative way with Mavacamten, Prilosec and the class of medications that Prilosec is associated with. That's one. Nexium is another. St. John's wort, and grapefruit juice. So those are a few that are important to note. And then there's a list of others. But I think the take-home message is that it's really important that all of your medications are cross-referenced with Mavacamten, just to make sure that there's no drug interactions.
All right, thank you so much for walking us through that, Heidi. And thank you to our team that's here with me right now for being here and sharing this really important information with our patients and their families. We hope you are all doing well and staying safe. Thanks for joining us.
Thanks, Hannah.
Thank you so much.